Healthcare is a major concern for most British Columbians, from wait times at ERs to a shortage of doctors and nurses. And while it's mostly a provincial responsibility, a lot of the funding comes from Ottawa, and federal politicians have no shortage of ideas for fixes in this election. For more, let's check in with Rob Shaw at the BC Legislature. So walk us through, Rob, the plans for healthcare here.
Well, Stacey, the provinces control healthcare, but around 20% of BC's health budget, around $8 billion a year, comes from Ottawa. And all of the federal parties are promising to help better recruit foreign healthcare workers to Canada and open up more training spaces in hospitals and that type of thing. But there are some big differences, especially on the addictions part of healthcare. Conservative leader Pierre Poilievre has not proposed major private health expansion in this election, despite critics saying he stands for that. And he has promised not to pass any laws or regulations restricting abortion. Conservatives do say they would honor the current health transfers to provinces, as well as the Liberal NDP dental care and pharmacare programs, but they're proposing a new Blue Seal credential plan for healthcare workers to work in any province. On addictions, the Conservatives are pitching a total reversal of Liberal policies. They want to ban overdose prevention sites, halt existing supervised consumption sites, pull federal funding from safe supply programs, redirect it to abstinence-based drug treatment. And here's Poilievre on another promise about judges and involuntary care.
Possession of illegal drugs will remain a crime, but we would allow judges to order treatment as an alternative to prison when the offender's only crimes involve small quantities of drugs for their own use or other minor non-violent offenses. When someone is too sick to choose help, we won't leave them without hope. We'll help them take back control of their lives.
Liberal leader Mark Carney mostly campaigning on the successful record of Liberal and NDP policies, expanded pharmacare, dental care. He is proposing a $4 billion health infrastructure fund to help build things like MRIs and health clinics, a national license for doctors and nurses so they can work in any province, and a $20,000 per person first round of IVF treatment. BC has a similar program there. On addictions, there's kind of a status quo here. There's a new $500 million National Emergency Treatment Fund, making permanent some youth mental health, and continuing to work with the provinces like BC, because Ottawa and BC have partnered together on decriminalization and safe supply and overdose prevention sites.
As in so many things, healthcare is at the core. In the U.S., healthcare is a big business. In Canada, it is a right.
NDP leader Jagmeet Singh vowing to penalize provinces that allow private health care. He wants to boost transfers, guarantee everyone can get a doctor by 2030, which is an ambitious promise, expand coverage of essential medicines like diabetes and birth control. The Greens, they don't really have many detailed promises on health care. They advocate for more stable funding and more workers and expansion of things like home care and dental care and pharmacare. So, Stacey, on the plus side here, there's no parties promising cuts or cancellations to provincial transfers or health programs or that type of thing, not even the dental care programs. The differences are really kind of around addictions and mental health. The Conservatives wanting to go in one direction, moving away from some programs, and the Liberals still down that path there. Again, mostly a provincial issue, but a lot of federal money on the table.